Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about genitourinary histology, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss rationale and aims, learning outcomes, indicative content, resources, submission of evidence, Q&A ideas, evidence ideas, reflective statement, and some helpful tips to make candidates' portfolio better. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into this submodule. Rationale and aims of this submodule outline the general information and expected knowledge and competence that candidate needs to achieve when this submodule is completed. These are relevant to each submodule. For this submodule, the expectations are that the candidate will be able to prepare, process, and stain genitourinary histology tissue samples. Gain a clear understanding of the anatomy and physiology and the pathological basis of disorders of the genitourinary system and how these may be investigated histologically. The genitourinary includes kidney, renal pelvis, ureter, bladder, prostate, penis, scrotum, testes, epididymis, and spermatic cord. The learning outcomes demonstrate candidates' knowledge, skills, and competence in this submodule. They also include demonstration of the understanding of scientific principles, laboratory procedures, quality assurance, and professional conduct. They allow candidate to work autonomously and solve problems independently. The first learning outcome is, discuss how the anatomy and pathophysiology of genitourinary systems interact. Candidate needs to know how anatomy and pathophysiology of genitourinary tissue interact. Does the candidate know what is the anatomy and physiology of genitourinary tissue? Do they know how anatomy and physiology of genitourinary tissue interact? Candidate could consider kidney and the capsule, cortex containing nephrons, medulla divided into renal pyramids and renal sinus, pelvis through which urine drains into ureter, prostate and the functional zones, peripheral zone, the primary site for prostate cancer, transition urethra, the primary site for benign prostatic hyperplasia, central zone surrounding ejaculatory ducts, and stroma composed of muscle and fibrous tissue, acini that produce prostatic fluid, ducts that drain the fluid into the urethra, capsule that forms fibrous protective shell. Testis and protective outer layers consisting of tunica vaginalis, the outermost serous sac, tunica albuginea, thick fibrous capsule, and tunica vasculosa, highly vascularized inner layer, fibrous septa that divide testis into approximate 250 lobules that produce sperm, seminiferous tubules, highly coiled where sperm production takes place, tubuli recti, terminal segments of seminiferous tubules, rete testis, microscopic channels that collect sperm from tubuli recti, epididymis the single coiled tube where sperms mature, its regions, the head with immature sperms, body the highly coiled part where sperms acquire motility and fertilization ability, and tail that stores mature sperm, tunica vaginalis, serous membrane covering most of the epididymis, sinus of the epididymis, fluid-filled groove, vas deferens, thick-walled tube for sperm transport. Bladder and four main regions, apex, body, fundus, and neck, trigone to detect fullness, ligaments to anchor the bladder, sphincter that keeps the bladder closed, ureteric orifices that act as valves to prevent urine backflow. Pathophysiology of genitourinary organs and hyperplasia, malignant transformation, metaplasia, atrophy, fibrosis, inflammatory infiltration, muscular hypertrophy, trabeculation, diverticula formation, necrosis, infarction, luminal compression, loss of filtration selectivity, altered hormone negative feedback, or impaired contractility. The second learning outcome is, discuss how pathological processes including inflammation, neoplasia, and infection relate to genitourinary system. Candidate needs to know how inflammation, infection, and neoplasia affect genitourinary tissue. Does the candidate know how inflammation, neoplasia, and infection affect genitourinary tissue? Do they know the difference between inflammation, infection, and neoplasia in genitourinary tissue? Do they know what are the pathological processes of inflammation, infection, and neoplasia in genitourinary tissue? Do they know what are the histological features of inflammation, infection, and neoplasia in genitourinary tissue? Candidate could consider inflammation and acute and chronic type, inflammation as precursor for cancer, inflammation as a consequence of infection, cell infiltration, tissue damage, urothelial dysfunction, fibrosis, loss of function, specific histological features depending on the genitourinary organ. For example, kidney and glomerulonephritis and damage to filtration barrier. Testis and orchitis and impaired spermatogenesis. Prostate and prostatitis or prostatic proliferative inflammatory atrophy. Bladder and cystitis. Neoplasia and benign and malignant type, nuclear features, cellular appearance, architectural changes, differentiation, uncontrolled abnormal growth of cells, tumor formation, bleeding. For examples like kidney and RCC, testis and germ cell tumors, prostate and adenocarcinomas, bladder and urothelial carcinoma. Infections being the most common pathologies, susceptibility due to exposure to external environmental pathogens. Most common are ascending, moving from urethra upwards to bladder or kidneys, urinary microbiome and its role in infection, pathogen invasion, UTIs leading to cell injury, DNA damage. Overall, they could consider the importance of interrelationships between infection leading to inflammation leading to cancer due to consistent DNA damage and creation of favorable microenvironment for malignant transformation. Inflammation, leading to cancer, leading to further inflammation due to self-created vicious cycle of secreting cytokines that attract inflammatory cells. The third learning outcome is, explain when and why samples of genitourinary systems need to be prepared prior to dissection, as well as how this should be done. Candidate needs to explain when and why are genitourinary samples prepared prior to dissection. Does the candidate know, how are genitourinary samples prepared prior to dissection? Do they know the steps taken during genitourinary sample preparation? Candidate could consider orientation, description, weighing, measuring, inking, opening longitudinally or hemisection vertically, slicing, sample types like biopsies, fluids like urine or washings, chippings, partial or whole organs and the difference how they prepare them. The steps might be specific to each department, therefore they could consider SOPs, methodology used or RCPAF and NICE guidelines. The fourth learning outcome is, explain dissection, tissue selection protocols and block selection rationale for samples of genitourinary systems, as relevant to your lab. Candidate needs to explain dissection and tissue selection for genitourinary tissues. Does the candidate know, how are genitourinary samples dissected in your lab? Do they know, what blocks are taken and why? Candidate could consider gross examination, description, slicing, opening, systematic sampling approach to obtain adequate representation of pathology, block selection, sampling visible lesions or abnormalities, taking multiple blocks for larger tumors or for better representation, assessment of resection margins, inclusion of normal background tissue, specific anatomical landmarks like cortex, medulla, or spermatic cord. The steps might be specific to each department and each genitourinary organ. Therefore they should consider SOPs, methodology used and RCPAF and NICE guidelines. The fifth learning outcome is, describe how normal and abnormal genitourinary systems stained using H&E should appear when viewed with a microscope. Use examples relevant to your practice. Candidate needs to describe normal and abnormal genitourinary tissue on H&E stained slide. Does the candidate know, how normal and abnormal urinary tissue stained with H&E look like microscopically? Can they identify abnormalities microscopically? Can they identify genitourinary tissue on stained slides? Do they know the characteristic features of genitourinary tissue that can be used to identify it? In general, candidate could consider layers like mucosa, muscularis layers, connective tissue, functional units, cellular organization, cell borders, mitotic figures, nuclear, and cytoplasmic appearance. Kidney and nephrons, the functional unit of a kidney, glomeruli, capillaries surrounded by Bowman's capsule, proximal convoluted tubule lined with simple columnar epithelium with brush border for reabsorption, distal convoluted tubule lined with simple cuboidal epithelium without brush border, loops of Henle for creation of osmotic gradient, collecting ducts for urine collection, cell types like podocytes, tubular, juxtaglomerular, or principal cells. Prostate and glands or acini lined by pseudostratified columnar epithelium, stroma containing smooth muscle and dense collagenous connective tissue, corpora amylacea, small pink laminated calcification sometimes found in space, cell types like secretory cells that are hormone sensitive and produce PSA, basal, luminal or neuroendocrine cells. Testis and tubular compartment and seminiferous tubules for sperm production lined by germinal epithelium, interstitial compartment, reedy testis lined by ciliated cuboidal epithelium. Cell types like Sertoli cells creating blood testis barrier, spermatogenic cells, Leydig cells producing testosterone, myoid cells that can pump fluid and sperm out. Epididymis and pseudostratified columnar epithelium with stereocilia for fluid reabsorption, layer of smooth muscle to facilitate peristalsis that gets thicker and triple layered to facilitate ejaculation. Bladder and urothelium, transitional epithelium with stratified lining to prevent urine leaking. Mucosa, muscularis propria containing 3 muscle layers, adventitia and serosa. Cell types like superficial umbrella cells that can flatten to accommodate stretching, intermediate cells, basal cells that are constantly dividing. This is very specific to each organ and pathology. Therefore, candidates should consider abnormalities and how they affect the histological features seen microscopically. The 6th learning outcome is, explain when and why special stains, IHC markers, and other specialist histology techniques might be required to demonstrate abnormalities of genitourinary systems. Identify all the relevant stains and techniques. Candidate needs to explain the use of IHC and special stains on genitourinary tissue. Does the candidate know why and when would special stains and IHC markers be used to stain genitourinary tissue? Can they give examples of staining techniques used for genitourinary tissue? Do they know why they would be used, and explain what they detect? Candidate could consider cytokeratins, myoepithelia prognostic, for subtyping, to detect rejection, for pathogens like viruses or bacteria, for basement membrane or amyloid. Specific IHC stains like CK5/6, CK7, CK8/18 or CK20, P63, BKV and CMV for viral detection, Ki67 for proliferation, NKX 3.1, PSA for prostate adenocarcinoma, RCC, PAX8, CAKES for urothelial versus renal cancers, carletinin and October 3/4 for testicular cancer, C4D for kidney transplant antibody-mediated rejection. Special stains like renal panel PA, AG-MEF, EVG, for epididymis gram, ZN, Worth and Starry to identify infectious agents, Congo red for amyloid. The 7th learning outcome is, describe the staining patterns you would expect to be able to view microscopically for each of the IHC, special, and other staining techniques listed above. Use examples relevant to your practice. Candidate needs to describe staining patterns in genitourinary tissue. Does the candidate know the staining IHC and special stains for genitourinary tissue used in your lab? Can they recognize those staining patterns on stained slides? Can they distinguish between abnormal and normal staining pattern? Candidate could consider normal and disease-related staining pattern, marker, and stain-relevant pattern, localization patterns like nuclear, plasmic, membranous, Golgi or mixed staining, intensity of staining like negative, weak, moderate, or strong. Distribution patterns like diffuse, focal, heterogeneous, or peripheral. The 8th learning outcome is, demonstrate how you are involved in any part of the process between tissue preparation and reporting for a specimen related to the genitourinary system. Candidate needs to demonstrate their involvement in genitourinary tissue processing in the lab. Is the candidate involved in genitourinary tissue processing in the lab? Can they explain their role in the process between genitourinary tissue preparation and reporting? What tasks do they perform in the lab that are relevant to genitourinary tissue samples? Candidate could consider pre-dissection steps, inking, slicing, opening, dissection steps and candidate's involvement, processing and the schedule used and why, and any special instructions, microtomy and any special instructions, staining, molecular analysis or referrals, QC and block check, digital scanning, and issuing slides to pathologists. This is very individual and depends on the training and competency of the candidate, SOPs, and methodology used. The 9th learning outcome is, discuss how cellular pathology investigations impacts the management of patients with genitourinary disorders. Candidate needs to know about how histology investigations impact patient management. Does the candidate know how histology investigations impact the management of patients with genitourinary disorders? Do they know what information can be gained from histology results that can be used for patient management? Do they know if histology investigations can affect patients' diagnosis, treatment, prognosis, or monitoring? Can they list tests that can be used in histology to guide patient management? Candidate could consider lab investigations that distinguish between benign versus malignant, in situ versus invasive, tests enabling subtyping, grading, staging, differentiation, diagnosis, prognosis, guiding therapeutic decisions, lymph node status assessment, detecting lymphovascular invasion, genomic profile monitoring, establishing predictive value, digitalization of results for sharing and MDTs. The impact of investigations like offering surgical options, therapeutic options, personalized treatment, for monitoring disease progression, monitoring treatment response, prognosis, to speed up process and improve therapeutic accuracy. Indicative content highlights background knowledge that might be assessed during the viva. They may or may not be demonstrated by the learning outcomes or candidate's evidence. In this submodule, candidate is expected to have the knowledge and understanding relevant to tissue preparation techniques for samples of genitourinary tissue. Basic and advanced staining theory for stains that may be utilized for samples of genitourinary tissue. Quality control for basic and advanced stains that may be utilized for samples of genitourinary tissue. EQA schemes for staining techniques associated with urinary tissue. Tissue retention requirements related to samples of genitourinary tissue. The principles of tumor grading and staging with respect to genitourinary tissue samples. Invasive and non-invasive surgical procedures and their relationship to the collection of genitourinary tissue samples. Indicative content also highlights skills and competence the candidate is expected to be able to do. For this submodule, candidate must be able to use microscope. Resources section on the Brightspace contains some very useful information for this submodule. Submission of evidence section on Brightspace informs the candidate what evidence needs to be submitted for each subsection. Candidate needs to submit answers to questions that were set by the training officer. I will share some examples of possible question suggestions later on. Candidate also needs to select an additional piece of evidence relevant to this submodule. For evidence ideas, please have a look at the video for trainee. Each submodule also requires the candidate to submit their reflective statement relevant to their practice and training in each submodule. These are some example questions you could give your candidate to test their knowledge, competence, and skills about this submodule. These should be based around the learning outcomes mentioned earlier. These are some more example questions you could use for this submodule. You could ask them to complete tables you created based on the learning outcomes. Or you could use images to test candidates' knowledge and competence. Supporting evidence should be selected by the candidate. It needs to be based around the learning outcomes and indicative content, and be relevant for each submodule. The evidence should allow the candidate to demonstrate their specialist knowledge and competence in each submodule. It should be specific and relevant to the candidate's in-house practice. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Each submodule also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each submodule. How do they demonstrate that they can draw conclusion from what they have learned, reflect on their current practice and how it can change in the future due to gained knowledge? They could think about what is their lab role in context of this submodule. What impacts can their actions have on their colleagues, department as a whole and for the patients? They also need to write a personal reflection on their training in the lab, and explain why they chose their evidence. This is very personal to their own circumstance. It should demonstrate their ability to be self-aware when analyzing gaps in their knowledge. They can use it as an opportunity to reflect on aspects of their training, application of their gained knowledge and skills, and how they have achieved their goals. They should think about what their evidence demonstrates and why they chose this specific evidence for this submodule. Also, they should write about what their training was like when it comes to this submodule and how their practice changed due to their training. Their reflective statements can also be used as a CPD evidence in case they are chosen to be audited by the HCPC. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, animations, pictures, posters, flowcharts, videos, photographs, PowerPoints, diagrams, graphs, infographics, charts. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like a case study, for each submodule. They could use experiments, case studies, annotated results, troubleshooting, controls production, annotated images, risk assessments, glossary, training presentation, certificates with reflective statements, nonconformances, validations, verifications, comparisons, ECHA results, annotated audits, kappa or DATIX, Q&A. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If they like experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the learning outcomes and indicative content in mind when they are selecting their evidence. Learning outcomes that require the candidate to demonstrate something would be ideal for covering with their evidence. And this brings me to the end of today's video. Hopefully you now have a better understanding about the learning requirements for this submodule. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those learning outcomes in mind when selecting questions and guiding the candidate. Bye for now.